acute rejection all occur. And the mechanism is endotheliitis, which is due to stimulation of T lymphocyte against the donor parenchymal cell, and this leads to uh, stimulation of the antibodies and lead to damage to endothelial cell due to T cytotoxic cell attract the endothelial cell and also neutrophil and microthrombi formation and necrosis. And here will show us the antigen presenting cell and need to present the donor antigen, for example kidney, to T helper, and T helper will secrete a cytokine 245 lead to stimulated B cell to secrete antibodies and lead to stimulate T cytotoxic cell lead to cell-mediated cytotoxicity, and here lead to secrete a lymphotoxin with gamma interferon, which is lead to stimulate a macrophage, lead to inflammatory reaction, and all these lead to damage to the graft. So there are two types of the stimulation of the T lymphocyte. First, the direct allorecognition, which is the antigen of the donor, which is carry the donor antigen and presented directly to the patient T lymphocyte. And another mechanism, which is the indirect allorecognition, and here the tissue of the graft of the donor, which is present on its cell surface of the cell, the MHC molecules plus donor antigen, and this leads to stimulate the patient dendritic cell, and this dendritic cell will process this antigen and present it to patient T lymphocyte and lead to stimulation of the T lymphocyte. So in the direct, here the dendritic cell of the patients, while in the indirect, there is a stimulation to dendritic cell of the patient and stimulated to T lymphocyte, while in the direct, this is the dendritic cell of the donor. This is the dendritic cell of the donor, which is lead to direct stimulation of the patient T lymphocyte, while in the indirect, there is a stimulation of the patient's dendritic cell, and this lead to stimulate patient T lymphocyte. Chronic, the last one, the chronic rejection, which is occur years after transplantation, and this lead to stimulation to a delayed type delayed type T lymphocyte, and this lead to delayed type hypersensitivity reaction, which is type 4 hypersensitivity reaction, and this lead to fibrosis, graft arteriosclerosis, intimal smooth muscle proliferation, and luminal occlusion of the blood vessel. So this is the blood vessel, and this leads to stimulation to T delayed type, which is characterized by CD4, and this leads to secrete a cytokine, and this leads to a proliferation of the smooth muscle of the blood vessel, increase the intimal diameter, and this lead to occlusion of the blood vessel, lead to ischemia and necrosis of the graft. And this smooth muscle proliferation is occur due to secretion of transforming growth factor beta from the due to secretion of transforming growth factor beta from the macrophage, and this lead to smooth muscle cell migration and proliferation and this lead to luminal obliteration, and also this lead to fibrosis. So in order to prevent the rejection, so we use the immune suppressive therapy, and this immune suppressive therapy, which is the chemotherapy, and this leads to suppress the immune response, and also affect rapidly dividing non-immune cells like epithelial cell of the gut, bone marrow, and hair follicles. And this leads to increased side effect of it and increase the risk of infection. And the best immune suppressive therapy, which is the azathioprine and immuran, the mechanism of action diminished T cell proliferation and the S phase, synthesis phase of the cell cycle. And the Iraqi patients with renal failure, they have regular uh, uh, regular intake of this immuran from a chronic teaching hospital because it's a chronic disease. And this in order to avoid the effect on the rapidly dividing cells, so they synthesize a specific immune suppressive drug, which is reduce the immune response only and not affect the dividing cells. So they produce or synthesize monoclonal antibodies against the T cell, monoclonal antibodies against the CD4 T cell, against the CD3, against interleukin 2 and interleukin 2 receptor, against the ECAM, intercellular adhesion molecule, and LAFA1 lymphocyte functional antigen 1 molecules. All these molecules, they responsible for the T lymphocyte stimulation. As we remember from the second year, that T lymphocyte stimulation occur by two signals, signal 1 and signal 2. So they produce monoclonal antibodies against the signal, against the CD3, against the CD4, against the CD28, and this leads to prevent the T lymphocyte from proliferation. There is another uh, subject, which is the privileged site. This privileged site is that the antibody did not recognize these organs, and so there is no rejection. First, the cornea, which is absence of any blood and lymphatic vessels. So the ophthalmologist do cornea transplant without any rejection, and also lens, lens of the eye, also the brain, which is a presence due to presence of blood-brain barrier, which is to prevent the entry or exits of many molecules. And this is theoretically uh, theoretically proof, while practical there is no brain transplantation. There is a new subject, which is Graft-versus disease. We spoke about the uh, stimulation of the patient immune system against the graft, donor graft. Here is the opposite. The graft will attack the host immune cells, and this is occur in the bone marrow transplantation. And in the Graft-versus disease, the donor mature T cells in the bone marrow will attack the host lymphocytes. So before we did bone marrow transplantation, we must kill uh, all lymphocytes present in the patient blood. So using of the immune suppressive therapy, lead to tumor formation. What's a tumor? Tumor is a